Hello, I'm James McLoughlin from TAP, Thank and Praise. And together with Simon Gamewell, we're going to be talking about how the power of gratitude boosts workforce well-being. Now, I probably don't need to convince many of you listening to this today that gratitude does indeed boost well-being. It's well documented by scientists, psychologists, HR leaders, and of course, well-being professionals as well. But for me, it's about what it makes me feel, what it makes me feel at an individual level, and I'm sure that's what you share as well. This quote from Harvard Business Review sums it up very nicely. Being thanked at its most basic level lifts you up. It's also energizing. So what about at a workforce level? Well, there are 4 benefits to praise and thanks in a workforce environment. As I've said, it enhances well-being. Gratitude does indeed make staff feel valued. It creates greater optimism and increases your energy levels. It's also great for building resilience, ever more important during these challenging times. And yes, it does increase motivation, which is brilliant for improving job satisfaction. Ultimately, and fundamentally, it also helps improve the patient experience. After all, if you safeguard your workforce and their well-being, they in turn are going to look after the patients and make sure they receive the care they need. So what's TAP and what's our story? Well, 18 months ago, Sandy Curtis, the founder of TAP, created Thank and Praise. And that was off the back of 18 years of working with the healthcare and the education sector in a brilliant, positive way in order to help her special needs son, Donnie. She had superlative support from both these sectors, healthcare and education. And actually her frustration, funny enough, was that you couldn't always pass on the praise to the right people. It was almost as if the systems were in place to receive complaints and not compliments. And it was that frustration that actually was the starting point for TAP. So TAP's mission, really simple. Let's make it easy for people to thank the unsung heroes working in healthcare, and in particular in the NHS. And what is TAP precisely? Well, it's actually a social thanking platform. It runs on mobile, it runs on web, it runs on social media. Fundamentally, it enables the public to show their appreciation to healthcare workers. And every message is checked to ensure only positive messages are shared. It's designed to improve the mental well-being of society's unsung heroes. We all know too well the ongoing well-being challenge within the NHS and within the wider health community. Too many members of staff in the healthcare sector have felt unwell as a result of stress. And perhaps too few organisations are actually creating positive action on health and well-being on behalf of their staff. It has gone up slightly since last year, according to the NHS staff survey, but 29% is still not enough. And we know also there's a big new well-being challenge in the guise of COVID-19. We know from a recent NHS Confederation survey that 9 out of 10 respondents are concerned about the long-term impact of COVID on the well-being of their staff. And investment is fundamental, both in terms of time, money, and energy. And that's perhaps in short supply as we have to focus increasingly on patient welfare. So what's TAP doing about it? And what have we done about it during the COVID-19 first phase? Well, we diverted our energies away from our mobile application to create a set of digital thanking walls to make it even easier for the general public to post messages of support and thanks to healthcare workers. As you'll see from that brief description, the campaign generated messages of thanks from hundreds of healthcare organisations, both in word form, but also in video form as well. Poems were written, songs were created, and messages were read out aloud on YouTube. And actually, they were viewed over 500,000 times during the course of the campaign, all, of course, at zero cost to healthcare organisations and the public. These are just some of the positive messages of thanks that we received. You'll see that many of them were specifically aimed at hospitals or clinics, or indeed pharmacists or care homes, such as the one to John Radcliffe Hospital. I'm so very grateful for the professionalism, care, grit and determination that you and your team have provided. Thank you for putting your lives at risk for the benefit of us all. But we also had some incredibly overarching ones for the wider NHS. To all our NHS heroes, thank you for your caring, for your calling, your strength, and having extraordinary commitment in these challenging times. These messages came from all around the UK. And that very much mirrored this public outpouring of national gratitude that we were seeing in the streets with Clap for Carers and so on. And what was amazing about it is that we work with a number of media partners to not only share the messages through social media and directly, of course, with the organizations that were named, and where possible with individuals, of course, as well. But actually we had a huge amount of goodwill and support from the BBC Make a Difference programme. And our messages of thanks were read out across the country on their local stations. But ultimately, it's what the NHS or the care workers feel about the thanks that really tells us whether it's making a difference or not. You can see from these brief quotes that we've got, and we have many more, that actually it was very, very well received. I'll pick up on one from Norfolk and Norwich University Hospital. Thank you for taking the time to send us your compliments. In a time of increased stress and pressure in the NHS, it makes a massive difference to morale to hear positive comments about the service we provide. And perhaps at a deeper level, what do individuals think? What are they experiencing when they're getting these messages of thanks? Well, this came from an individual, and it's very heartfelt, of course. To receive an unexpected message of thanks, whether that's on a mobile or through an email or through a social media feed, does generate a huge smile. And in this current world of negativity, it shows there's nothing better for mental health than reading a kind word of praise. We didn't want the thank you wall to be the end. We've created a lasting legacy to society's key workers during COVID through a tap book of thanks. It's complemented by beautiful images from school children around the country, and you can download it yourselves at the URL that's on the slide now. And of course, the whole point of why Sandy created TAP in the first place was so that thanks was not sporadic, was not just during a crisis, but actually was long-term. And the TAP platform allows a long-term solution to thanks and praise being targeted and generated from the public to the healthcare workers. I'm now going to pass you over to my colleague, Simon Gamewell, who's TAP's healthcare advisor. His brief quote probably gives you a clue as to why he's working with us. But without further ado, Simon.
Hi there. Yeah, I'm a healthcare advisor at TAP, and I've got a unique perspective on gratitude. I've been at both ends of the spectrum. I started being interested in gratitude when I was at university, where I studied drama. And if you study drama, gratitude is not just appreciated, it's expected. Every step of the way it is applauded by your peers, by your tutors, and often by the general public as well. When I first started directing plays at university, the first play I directed, I told the actors there was to be no curtain call. At first they were very angry. Some of them even threatened to resign. But I asked them to bear with me. Said that there would be a chance for them to receive gratitude. So the play ended in silence. And after the play, I threw a party in a separate room with drinks and a buffet lunch. And it allowed the actors to meet the audience and to receive individual gratitude. I put a sign on the door saying, if you didn't like the show, tell the director. If you did like the show, tell the actors. Unfortunately, I spent the afternoon standing in a corner alone. The actors really grew to appreciate the power of individual and institutional gratitude. After university, I tried my hand at stand-up comedy. Probably the hardest thing I've ever done, because in comedy, gratitude is the only currency. But I wasn't really funny enough, so I ended up becoming a teacher, which my friends at the time thought was much funnier than my stand-up comedy routine. I taught English in many places around the world, but especially in Vietnam. And in Vietnam, gratitude is part of the culture. Even if I was teaching adults, at the end of every class, all the teachers, all the students would stand up and say, "Thank you, teacher," to express their gratitude. This was lovely, but that wasn't what really stood out in my mind. It was really when students felt the need to go that little bit further, but when they waited behind after class to give me a card, a small gift, a cup of coffee. I had one student who I taught privately. He was desperate to go to a British university. So I improved his academic skills. I taught him how to behave in an academic environment. And finally, he went to the University of Brighton. And he's now living in Los Angeles, and he's a successful businessman. Years after I taught him, he sent me a message saying that I was the best teacher he'd ever had, and that he really wanted to express his appreciation. That was a defining moment in my teaching career. My teaching career, which changed dramatically while I was working in China. I was getting ready to go for work one morning, and I had an epileptic seizure. At the time, I didn't even realize I suffered from epilepsy, but I fell from a 6-story balcony onto a concrete floor. And I broke my back in several places, and I spent a lot of time in a Chinese hospital. That was tough, but because they didn't even speak any English at all at the hospital. I was then transferred to Pinderfields Hospital in West Yorkshire. And that's when I really understood gratitude from the opposite side. The nurses go about their work, but they feel special. They feel much happier when gratitude is expressed to them. So I was very keen to let the nurses as a unit know, but also to send individual messages of gratitude. In fact, while I was in hospital, I realized that so many healthcare workers suffer from mental health issues. Yeah, that they have great peer support. They work as a team, but they also have to work individually. And because I'm a bit younger than most of the patients they dealt with, I became friends with many of these nurses. And some of them would come to me, especially during the night shift, and they'd pour their heart out, and they'd burst into tears because they were suffering so much. Nurses don't always have time to go and see a counsellor because their daily routine is so hectic. So I became that counsellor. And I realized that when we express messages of gratitude, it's contagious. It spreads. If I send someone a message of gratitude, they feel happy, I feel happy, and anyone who finds out about the message also feels happy. And this is why I joined TAP, because TAP provides an atmosphere, an environment of gratitude. I sent one nurse a message, and she was so happy to receive it. She posted it on her Facebook page for all her friends and colleagues to see. So gratitude keeps on growing. And TAP is a socially motivated organization. It's there to spread positivity. We had the Clap for Carers, which was a great initiative. But it shouldn't have stopped there. Gratitude needs to keep on going. The nurses keep on working, the doctors keep on working. We need to keep thanking them. And in order to make gratitude more proactive, because it can be very, very passive. So we're making it more proactive. In fact, I've created and I'll be hosting a new radio show called Gratitude with Attitude, which will be going to a hospital radio station near you soon. So I hope you can check in on that, and let's keep spreading the positivity. Okay, James, back to you.
Simon, very, very good to hear from you. So what are the benefits of TAP's platform? Well, as we've heard, TAP has a number of different positive attributes. Patients and families, and indeed the wider public, can thank, praise and raise through the TAP platform. They can thank a member of healthcare staff privately. They can praise a healthcare organisation publicly via digital thanking wall. And they can even raise funds for a healthcare charity via a match-funded donation platform. And specifically, at a stakeholder level, healthcare workers receive the thanks they deserve on a regular basis. Patients and their families are no longer frustrated, and they can easily thank their carers. Healthcare employers benefit, of course, from improved staff wellbeing, and healthcare charities can raise much needed funds, all at no cost to the healthcare organisation. So what about a TAP organisation perspective? Well, this is an interesting one from the Adam practice, which is a large GP practice in Dorset with 4 clinics. They are going to be using the TAP platform to thank all members of their staff via their patients. And when I say all members, I mean clinical and non-clinical, of course. Everybody in a clinical practice or hospital or care home deserves to be thanked. Patients can also praise the GP practice at a wider public level. And as I've mentioned previously, they can raise money for their own particular charity. And Claire Meachin, who's the nurse manager and indeed a Queen's nurse at the Adam practice, is very much a supporter of what TAP's platform can do. And just really to close, I'm absolutely delighted to say, hot off the press, that United Lincolnshire Hospitals NHS Trust is the latest addition to TAP's organisations. And Sharon Kidd, Patient Experience Manager at the United Lincolnshire Hospitals NHS Trust, sums it up really nicely by saying, we all know that happy patients make for happy staff. And of course, the reverse is true as well. Happy staff, of course, are that much more able to give the provision to patients that they need. So all in all, perfect synergy. So in terms of next steps, if you'd like your healthcare organisation to benefit from TAP's free-to-use thanking platform, which of course also features a donation platform as well, please contact us via the Get Involved page on www.thankandpraise.com or drop me an email. This is actually our animation that you can see on our website that we ran over the summer period to attract messages from the general public, and it ran on a number of TV stations. And just to close, I'd like to say on behalf of Simon and myself, thank you. Thank you for listening. Our details are here and we'll be delighted to hear from you.